Let's start tetralogy of fallot. TOF is basically combination of congenital defects in the heart which arise due to one single reason: anterior superior displacement of the ventricular septum. And which part? The infundibular part of ventricular septum. And due to abnormal migration of neural crest cells, the septum gets displaced anterior superiorly, due to which four things occur. If this is normal heart, then in TOF this displacement occurs. Along with it, the aorta also gets displaced. So this is known as overriding of aorta. Aorta now has some part of it receiving blood from the right ventricle. So the blood gets mixed and the oxygen level comes down in the aorta. Along with it, three more things occur. Due to shifting of the septum towards the right side, pulmonary artery gets stenosed. Due to pulmonary stenosis, the afterload on the right heart increases, due to which right ventricular hypertrophy occurs. And since only the infundibular part of ventricular septum gets deviated anterior superiorly, ventricular septal defect also occurs, because the other part of ventricular septums are in their exact same location and only the infundibular part gets deviated. Okay, so basically four things occurred: overriding of aorta, ventricular septal defect, pulmonary artery gets stenosed, so pulmonary stenosis occurs, due to which right ventricular hypertrophy occurs. So now here we have two things together. Firstly, we have ventricular septal defect, and secondly, we also have outflow obstruction of the right heart. So the blood from the right heart gets shunted towards the left heart from ventricular septum, and aorta is also overriding, so it is also receiving some blood directly from the right ventricle. So the oxygen saturation of aorta decreases, due to which cyanotic spells can occur, which are known as TET spells. These spells can occur when, due to any reason, right ventricular outflow obstruction increases, which can occur due to exercise, fever. Basically, whenever respiratory rate increases, the right heart outflow obstruction increases, like in fever, in exercise, when the child is crying, the respiratory rate increases, etc. During these spells, there is sudden bluishness of lip, mouth, nails, due to rapid drop of oxygen levels in the blood. So during these spells, what we can do, the afterload of right heart is increasing, so blood is getting shunted towards the left heart. So if we can increase the afterload of left heart, the shunting will decrease and the oxygen saturation will increase. So what we can do in these children, we can ask them to squat. So while squatting, the afterload to left heart increases and no shunting occurs, and oxygen saturation increases, and we can break the cyanotic spells like this. Some children, infants who can't squat, we can ask the caregiver to give them knee chest position, which will simulate the squatting position and will increase the afterload to the left heart and will decrease the shunting. And due to right ventricular hypertrophy, patient often have boot shaped heart and a prominent right ventricular impulse. So this is it for tetralogy of fallot. I hope this helps.